My name is Leslie Gregory, and I practice medicine in Portland, Oregon, and I have a nonprofit called Right to Health, and we have a campaign pushing back against the government or the Centers for Disease Control and Prevention to force them to do what they're empowered to do, which is prevent and control disease for the public. I believe racism meets that 4 criteria that they have for that threat, and we're trying to ask them to do their job, particularly now that we have evidence that it's directly related to everyone's health, not just the health of people of color. So CDC has 4 criteria for what constitutes a threat to public health. One is that it's a burden. It's an economic burden on the culture. The second is it's disproportionately shared by a section of the population, whether that be female, gay, pregnant, smoker. So, but the other is that it shows that current measures are not enough. So in other words, that problem is continuing despite what's being done currently. And the last one is that there's evidence that upstream change will affect that problem. In other words, institutionality, the institutional problem of it. What we're saying is racism meets those 4 criteria. So we're asking that CDC do their job, declare it a threat to public health, and then follow the protocol just like did for other public health problems in the past. Zika, HIV, smoking, diabetes, these other campaigns. The way that we want to do that is it needs to be effectively, definitively, and publicly announced as the threat that it is. That way, people can then begin to speak about racism and less about health disparities, social determinants of health, these other code words that have currently been used. We are saying if CDC will do that, we will begin to save the disproportionate number of healthcare dollars, lives, unfortunate incarceration, gun death. So much of the underlying cause will be mitigated, and that money will be saved and put into education, healthcare, the kinds of things that we now know have been neglected instead. Because in primary care, the idea is not just to treat the symptom, we pursue the cause of the symptom. It seemed only reasonable to apply that to this particular inequity. As time has gone on, we've begun to see more and more how that same underlying cause, racism, also harms people who are not marginalized, people who are not targeted by these inequities. Our question is, how do we know that racism is affecting the health of people, all people in our country? And I believe one of the things we're seeing, and particularly in primary care, is an increase in anxiety disorder and those pathologies associated with it. Hypertension, poor health choices, lifestyle problems, obesity, binge eating disorder, these kinds of chronic problems that we can no longer afford as we're also beginning to have economic stresses on our healthcare finance. And what we're saying to CDC is, you've been dealing with the fever long enough, it's time to deal with the virus underneath. There are many factors that play into the health risk that racism conveys. One of them is cognitive dissonance. This is the idea that 2 opposite and opposing states of reality cannot exist at the same time. And if it does, that creates a sense of stress to the living organism that it entails. The idea is if you deny that feeling, deny that it's happening, refuse to see that it's happening, that too is another stressor. The potential for advancing and saving and conserving our globe's most important natural resource becomes very clearly evident when you realize it's humans. And so that's the goal of our campaign, is to say enough. You know, we need to mature as a species beyond the tendency to other. And many people in the anti-racist community have adopted that word because racism seems to be so triggering. We now use the word othering or marginalizing or targeting because again, like so many of the words we've used over and over again, we get triggered by them. My belief and my deep wish for mankind is to learn and evolve past this idea of othering before we reach out into space as we've done, because I'm very concerned that that's our next step. If we're going to explore and invite the universe into our world, I think we better learn to deal with our own sense of othering so that we don't further perpetrate into our next evolution. I think one of the things that has become so clear as a threat and a stressor to our existence and our coexistence is this stress of cognitive dissonance. When we wake up every morning, and as children, certainly in the past, we would hear ourselves repeating the Pledge of Allegiance and living in the land of freedom and equity, and yet walk around in our world to see that massive mansions are mere blocks away from just squalor and deprivation. Even if we don't understand it on a conscious awareness level, somewhere in our human soul, we realize that it's just not true. And you get this low level of dis-ease. The same must be true for children. When they grow up and their parents tell them, we're all equal. We love all people. We're Christians. Be like Christ. Treat your neighbor like your brother. And yet we see images of incredible violence and depravity and disregard and marginalization and hate speak. This must impact in small increments on a daily, inescapable basis the inhumanity that is in direct conflict with the natural humanity of the child. And I believe that over time, this incongruity in a young child's life can see exactly what we're seeing now. Acting out, frustration, poor choices, impulse control, rebellion, at a very early age, and I think it's getting earlier, and we're seeing some of these behavior problems. This harms the majority culture. This harms the young, perhaps white, for lack of a better word, male, who wants to play or wants to, in other words, include in his or her tribe a person who's been marginalized. This creates a stressor in their world. And that too, as a part of their cognitive dissonance, becomes this suspicion. Well, if this isn't true, what else have you been teaching me that isn't true? What else about this institution called democracy, equity, justice? What else isn't congruent? What else am I going to find out as I grow up that I've been told but isn't true? And I think what we're seeing now is a lot of rebellion, a lot of rage, a lot of this sense of disenfranchisement with our government, distrust. And this, again, is another way that racism harms majority culture. You get a buyout. You get an opt-out phenomenon. Well, I don't trust anybody, so I'm not going to vote. So we don't want our citizenry disengaged. If you're going to have a democracy, you need an engaged, participatory citizenry. And when we see these kinds of incongruencies, we tend to disassociate, disengage. And that's how racism hurts all people. Arguably, the price is bigger for people of color as direct targets. But I think on a national basis, we're seeing exactly what were described, what we expected. In more recent times, we're seeing an increasing amount of stress in majority culture, less so in minority culture because it's not new. And I think, we're seeing a lot of people who would not ordinarily feel a buy-in to this issue now saying, wait a minute, this isn't okay for me. Now we're not only treating people who are very, very ill, but we're also treating poverty. And let me tell you, that's the worst cancer ever. First, we've got to stop talking about it the way we are, this health disparities and social determinants, and call it what it is. It's racism. I think that's the first step. But after we call it what it is, yeah, we're going to flip that script and we're going to get the blame and the shame out of it. This is it's an institution, it's something that was done to all of us. And none of us now wants this for our children. None of us.